Hi, my name is Sarah, and this is going to be my demonstration of changing a dressing on a central line or open access, also known as a CVAD. So the first thing that you need to do is to verify your doctor's order. So you just may want to note if the patient has any allergies, if you need to look back on any policies or procedures on this certain procedure, now is the time to do that as well. So you just kind of want to do all your research before actually going to the patient's room and trying to perform the procedure. So once you've verified the doctor's orders, then you want to gather all of your equipment. So most of the equipment you'll need is in a dressing change tray, which I have here. Then I also have a mask, some hand sanitizer for hand hygiene, and some non-sterile gloves. I also have some tape just in case I need it, and a bio setup. So I'll just grab all my equipment once I've gotten everything put together, and then we can go into the patient's room. So once you go into the patient's room, you want to ensure patient privacy. So you want to close the door, the curtain, and introduce yourself. So I would say, hi, my name is Sarah. I'm going to be your nurse today. I'm taking care of you today. And then you want to make sure that you have the right patient. So you always want to make sure by using two patient identifiers. So the most commonly used is the name and date of birth. So you would just ask them to state their name and their birthday and make sure it corresponds to their hospital bracelet or the chart that you're looking at. So once you know that you have the right patient, you can kind of explain what's gonna be going on or what's gonna be happening, what they can expect. So just tell them that the doctor has ordered a dressing change of your central line to make sure that you don't get an infection. So you can, if they have any questions, you could answer those now before you begin. But if they don't have any, then you can go ahead and begin. You can maybe ask the patient if they have any allergies to any contents of the equipment that you would be using on them. Put them in a comfortable position, so slightly elevate the bed. I'm pretty tall, so I would elevate the bed to like a good working height for me and put down the side rail that I'm working on. So once we've done all that, I can go ahead and perform hand hygiene and put on a mask and set up my bio and put some gloves on so we can inspect the original dressing so we can look for any signs of infection. So I do have a little table set up to my left with all the things. So I'm going to go ahead and do my hand hygiene, put on a mask. This would be a good time to explain to your patient that they can't breathe on the open access while it's exposed. So if they're not able to follow your simple directions, then they will need to put on a mask as well. So it kind of just depends on your patient, and I believe that would be the judgment of the nurse. Because I think it would just depend on your patient. So I'm going to put on my mask. I'm going to apply my clean gloves. And these are just regular gloves. You're not sterile. Okay. So now that I have gloves and a mask on, I'm ready to inspect the original dressing. So, here's my patient. So, we want to look for signs of infection, and we also want to palpate just the surrounding skin for any tenderness. So, you just kind of go around and just feel for any swelling. Ask if she has any tenderness, he or she, any tenderness, redness. Those could all be signs of a possible infection happening. And you also want to kind of lift up the original dressing from the skin a little bit. And this just makes it easier while you're doing the actual procedure. So when you remove that, it'll just already be kind of off of the skin. So now since we've inspected the original site, we can go ahead and take off our gloves. You also just want to keep what it looked like in mind because we will have to document it later. So now I'm just going to take off my gloves, open my kit, get my sterile field ready, and put on my sterile gloves. So I'm going to take these off. I'm going to do hand hygiene real quick. Put this on my car. So I have my kit here. So I'll just open my kit. And go ahead and place my sterile field. Put this off to the side. I'm just gonna try to open my field very meticulously. So then you can see I have my sterile gloves at the top, so I'm just gonna grab those and put them on my side table. So I can put those on. I'll just turn it. Before I put on my sterile gloves, I want to introduce my bio patch. This would normally be in like a package. I'll just place this in my sterile field. Just open this up at the edges. I'm going to go ahead and our sterile gloves. There we go. Turn it around. And then we kind of just want to get everything set up so it's easily accessible when we're doing the actual procedure. Okay, so I would open up my alcohol like so I can just take out the swab really quickly. And then I have my other dressing here, and my chlorhexidine swab looking thing. So yeah, so now we're ready to go ahead and do the procedure. So to keep it sterile, one hand will be I'll make non-sterile by touching the tube and the old dressing, and then this will be my sterile hand where I do all the cleaning. So I just want to go ahead and remove my So I'll just go ahead and finish removing my dressing. So I put this in the vial. And then I will remove my old patch. This is a big patch. And put that in the vial as well. And now I can hold my tubing and start cleaning. So first I'm going to do the chlorhexidine swab. Now I would just push these two levers in and it would come out in the foam part. And then you clean the dirty. So I would do around the base first. And then clean up on the tube a little bit. Now I would throw this in the vial. And then now we can do our swab. So, and then you would just do the same thing, clean out the base, and then up on the tubing, and throw it in the vial. So now I'm ready to add my new patch. I'll just grab this and add my new patch. My tubing's a little large for this patch. It's not the right tubing. Right. So I have the new bio patch in place. And now all I have to do is put on my new label. So here I have my label. Just gonna set that down. Then I would add my new label. Or just pretending. So then once I've done that, I'm almost done with the procedure. I just need to clean up my area so I can take off my gloves. And kind of ball everything up in my sterile field and put it in the vial. And I also want to put a label on the dressing. I want to do hand hygiene. And then I'll write my initials, the date, and the time on the dressing so the next nurse knows when it was last changed. So I would put all that information on here and add it to the dressing. So I make sure everything's in my bio. Take this off. And my area is cleaned up. And then you just want to do completion protocol. So make sure the bed is in the lowest position. Make sure the 2 side rails are up. Put the call light within reach, personal items within reach. You also want to make sure the bed's in the lowest position. And then once you've made sure that they're comfortable and they don't need anything else, you want to document. So you'll want to document what the open access looked like while you were inspecting. You want to document how the patient tolerated the procedure, if any complications happened. Yeah. So you just want to make sure complications, what it looked like, how the patient tolerated the procedure. So that is my demonstration of changing a dressing in an open line. Thank you. Also document, also document the condition of the site and what type of dressing change you did, and just all the details, what it looked like and all that. So once you're done documenting, you are done with the procedure. Thanks.